discussing about, right. Now starting with the nerve blocks. In nerve blocks, in peripheral nerve blocks, we are having the brachial plexus block, we are having stellate ganglion block and other blocks. First, starting with the brachial plexus block. Brachial plexus can be approached by three major routes. First is the interscalene approach, and second is the supraclavicular approach, and third is the axillary approach. Interscalene approach. If you are going for interscalene approach, only the proximal segments will be blocked. Hence, it is best used for shoulder analgesia. Shoulder analgesia. Very important. Okay. Only proximal segments of the brachial plexus are blocked. As distal segment is not blocked, what is the nerve that is being spared in interscalene approach? It is the ulnar nerve that is spared. So I used to remember interscalene means I and U are not always together. यानी कि interscalene, what is the nerve spared? Ulnar nerve being spared. Next is what, guys? Supraclavicular approach. Supraclavicular approach is regarded as basically the spinal anesthesia of the upper limb. Why? Because supraclavicular is the best approach. Okay? It blocks all the roots completely. Okay? In supraclavicular, you are inserting the needle 1 centimeter above the clavicle. Okay. Now, in supraclavicular approach, the most dreadful complication that could occur is what? In supraclavicular, if you are not familiar with supraclavicular approach, the most dreadful complication that could occur is pneumothorax. But it is by far the best approach. Okay. Third is what, guys? Third is axillary approach. Axillary approach means you are inserting the needle through the axillary root to find the brachial plexus. This is used for distal arm surgeries. Distal arm surgeries. Now, in this approach, what you have to remember is, in this approach, what is the nerve spared? In axillary approach, the nerve that is being spared, it is the musculocutaneous nerve. Musculocutaneous nerve. So the brachial plexus approaches. Next is what? Stellate ganglion block. Stellate ganglion, why do we need to block? Remember, brachial plexus you are blocking basically for upper limb fractures, trigger finger release, or any upper limb surgeries you can go for brachial plexus block, or shoulder arthroscopies you can go for brachial plexus block and all. Why you're going for stellate ganglion block? Stellate ganglion block, whenever there is a sympathetic overactivity, you can block the stellate ganglion. In which condition sympathetic overactivity is seen, guys? In Raynaud's disease. Okay, stellate ganglion block, usually whenever there is sympathetic overactivity, you can block the stellate ganglion, such as in the case of Raynaud's disease, or if there is any drug-induced vasospasm, or if it is PTSD, you can block the stellate ganglion. And once stellate ganglion is blocked, remember stellate ganglion is located where? It is located near the C6 vertebra. Anterior to the C6 vertebra, you will find a Czachnick's tubercle. There you will feel stellate ganglion. Once you reach the stellate ganglion and block it, what is the once stellate ganglion is blocked with the help of local anesthetic, what is the successful signs that you see in the patient? You will see Horner's syndrome, Gutman's sign, and Muller's sign. What is Horner's syndrome? Horner's syndrome is nothing but ptosis, meiosis, and anhydrosis. Ptosis, meiosis, and anhydrosis. Whereas Gutman's sign means what? Vasodilation of nasal mucosa. Nasal mucosa. Or Muller's sign is what, guys? Vasodilation or hyperemia of the tympanic membrane. Vasodilation of or hyperemia of tympanic membrane.